What do you need to buy for your facelift recovery? Let's take a beach walk. So everyone is trying to sell you everything for that recovery period, telling you that it's going to be a game changer, that it's a must-have, that it's the number one comfort item for your facelift recovery. And I have found that oftentimes that is not the case. While it is very therapeutic to buy things for your recovery period because it makes us feel more prepared, a lot of the things they're selling aren't going to really help and could even cause harm. So there's three things I've seen commonly advertised to facelift patients that I really don't like. Number one is exotic Amazon torture device head wraps. I have expressed my disdain for head wraps previously, but especially in the recovery period, and especially some of these that I'm seeing on the internet that have multiple vectors of pull, Velcro around your neck, Velcro around your ears, they're putting a lot of pressure on a fresh wound bed. And all that is going to do is impede blood flow. It's going to trap swelling in your face because it can't drain down your neck. And it may even lead to skin breakdown where the edges are rubbing against your skin. So nothing good is going to come from a head wrap. You can avoid buying one of those. If you are one of the few patients that I feel actually needs a head wrap in the post-operative period, usually that's for large volume liposuction, I will absolutely give you a head wrap that I like. So no need to purchase one of those in advance. Number two is kind of along the same veins. It's an ice pack that is meant to be worn over the entire head and face, and again, Velcro's on and has all sorts of straps. I believe these are created with good intention. Icing in the post-operative period is meant for comfort. It should be done in 15-minute intervals. The problem with these strap-on ice packs is that they tend to get left on for too long. And if you're leaving ice directly over a fresh wound and then you're falling asleep, maybe for an hour or two, that can start to impede blood flow to the wounds. That can make you more likely to have wound healing issues or, heaven forbid, even skin necrosis. So for ice packs, the small little freezer gel packs are fine. A bag of peas, a Ziploc baggie full of ice. These are all good things that you can hold on for 15 minutes at a time, but you do not need anything that is larger and meant to be left on for a longer period. Number three is a fancy vitamin supplement regimen for postoperative healing. I have been sent by numerous patients in the last few weeks, none of them the same regimens, all these different regimens that are promising to rapidly speed your healing and promote cell growth and all sorts of crazy things. And I think almost all of them that I've looked at contain some proprietary ingredients, meaning you don't know what they are and I don't know what they are, and they could speed healing, but they could also make you bleed like crazy. So you need to eat healthy prior to surgery. Make sure you are well nourished, but unless you have a deficiency, there is no benefit you are going to get from taking these crazy supplements. Save your money. And you know, for supplements, the only one that really has any evidence I've talked about is arnica and bromelain. If you choose to take arnica, that is a fine thing to use the oral arnica starting 2 weeks before and continuing for a week after surgery. Similarly, bromelain, I feel like that's better obtained from the source, which is raw pineapple. If you choose to go that direction, if you like pineapple, start that about 48 hours prior to surgery. If you hate pineapple, please don't worry about it. What do you actually need for the recovery period? There's three things there. You need comfortable clothes with a large neck opening. Usually that involves something with a zipper or buttons to wear the day of surgery and those few days after, so it's easy to get on and off over your head wrap or over an area of swelling. Please do not make these your nicest crisp white shirts. The postoperative period involves a lot of ointment on incisions. There's betadine in your hair, things that can stain clothes. So make it something that's not too nice, not too white, and I fully support pajamas the day of surgery. Please do not dress up for me. I am not dressing up for you. I will be wearing black scrubs, I promise. The second thing you need is something to do. This is actually important because you are all resourceful, busy, high functioning individuals that now all of a sudden have 2 weeks off and do not know what to do with yourselves. So think in advance, what is that thing you've always been meaning to do? Or what's that Netflix series you've been meaning to watch for months? I had a patient recently go through all the pictures on her phone forever. I'm fine with all of these things. We want you to have something to do so that you don't get inspired to go run around doing things that are more exertional that you shouldn't be doing in the postoperative period. So bring your computer, bring an iPad, and take it easy. Number 3, you need something to eat. And this actually gets overthought all the time. I'll have patients telling me they got Jello and broth for their postoperative period. No, you will be able to chew. You probably aren't going to want to chew anything too hard. You're not going to be taking big bites like into a raw apple. But you do want to have food that's nutritional, food that you like, food that is comforting. You may want to avoid things that are too high in salt that may make you swell slightly more, and things that are easier on the stomach, avoiding a lot of spices may be ideal those first couple days, just as your body is taking a fair amount of medication and recovering from a big surgery. So amazingly, very little that you actually need to buy for your postoperative recovery. And you better believe that if there's something you actually need, I'm going to give it to you. Like your prescription medications, we have a fantastic local pharmacy, Cherry Grove Drug. They fill all the medications. They're delivered the morning of. They're there waiting for you. You don't need to worry about it. Similarly with any ointments, anything you need to be using on your incision lines, I'm going to give those to you to make sure you're using absolutely what you should be. So you are ready for surgery. Don't overthink it. Don't overbuy. And absolutely any questions, just let me know. So I appreciate you coming with me on this beach walk. If you have any topics you'd like to see for a future beach walk, please leave them below.